Hepatitis C is a virus, a blood-borne virus, and it affects the liver. So what it does is when you're exposed to the blood of an infected individual, the virus finds its way into the liver, and in the liver cells makes copies of itself. That allows it to live, replicate, and then go back into the bloodstream where it can affect other people. The difficulty with hepatitis C is that patients are asymptomatic for so very long, and when they do have symptoms that they're vague and no one would necessarily connect them to their liver. If you came to your doctor and said, I'm fatigued and I have some joint aches, they might check out your thyroid, they might check a few other things, but they may not think to check you for hepatitis C. Hepatitis C right now is going through a revolution in treatment. We've been treating hepatitis C since before we knew what it was, using interferon as a non-specific treatment for what we thought was a viral disease. Now, in the last 3 to 5 years, we've seen an explosion of new drugs in development, in clinical trials, and now licensed that directly affect the hepatitis C virus. Patients have to understand how serious the disease is. You know, you can't, if you don't believe this is important and you don't believe it's serious, the likelihood that you're gonna do it goes down. Second, we have to educate them on the fact we put so much emphasis on the virus being undetectable in the blood that in some ways that works against you. Because if it's undetectable in the blood, well then aren't I cured already? What is the next 6 weeks supposed to do? And so I think we have to educate patients at the beginning that undetectable in the blood is not undetectable in the liver. The big issue is, I think most of us see that therapy which is effective and can be used by all will be available. The question is, how will we do it? And at the end of the day, how will it get paid for? Which is the biggest questions now.